Every hospital is experiencing this a little bit differently, but I would say we're all going through the same situation.
As of November 2nd, Ontario hospitals with adult ICUs will now see children 14 years of age and older in need of critical care. This request made by the head of Ontario's Critical Care COVID-19 Command Centre, Andrew Baker, with hopes of alleviating some of the pressure felt in pediatric care at children's hospitals across the province. Children's hospitals in Ontario have not been immune to the surges. Last week, sick kids warned volumes in their emergency department remain unseasonably high and are increasing heading into the viral illness season. CHEO, a pediatric hospital in Ottawa, is also feeling the strain. This afternoon, their pediatric ICU was at 186% capacity.
This year, we are having the perfect storm. We're having RSV, influenza, and COVID all happening at the same time. And in previous years, younger babies would have had these illnesses, and by the time they're age 2, 3, 4, they have some immunity to these viruses. Now we're seeing, because we didn't see these viruses in the last few years, we're seeing them all come together, and there isn't that immunity that we usually see in older children. So we're seeing babies getting very sick, we're seeing toddlers, younger children, as well as older children getting sick. It's all happening at the same time. And there isn't the capacity that we need beyond the walls of CHEO to help look after these children.
Right now, across the province, there are 107 children in critical care and only 4 with COVID. Even with the assistance of adult ICUs, staff at CHEO say in their intensive care unit, many of the children have been under the age of 14.
We have been well over capacity in our intensive care unit for many days now. I believe our percent capacity was about 160% capacity yesterday. I do want to mention that although it's great, every little bit helps, that the adult hospitals can take some of our older patients, so over age 16 or now over age 14. Just to put it in perspective, yesterday, all of our children, so at 160% capacity, all of our children were under the age of 5. And the vast majority of them are actually under the age of 2. So we really need to do what we can to look after those children here, because we really aren't able to send them elsewhere.
For City News, I'm Stella Acquisto.